Yatyab. Opening hook questions. Did you know there is a rare disease that can make a child's brain age prematurely? Ever wondered about a condition that sounds straight out of a sci-fi movie? What if I told you there is a disorder so rare, doctors sometimes miss it entirely? Hey there, Paranoid. Today, I'm diving into something that might just blow your mind: Cockayne Syndrome. It's a rare genetic disorder that affects the brain and other parts of the body. But don't worry, I'm here to break it down in a way that's easy to understand. First up, what exactly is Cockayne Syndrome? It's a condition where children develop prematurely, almost as if they're aging faster than usual. It's named after Dr. Edward Cockayne, who first described it in the 1930s. Now, how is this rare disorder diagnosed? Doctors usually rely on a combination of clinical evaluations, genetic tests, and sometimes even MRI scans. It's not always straightforward, because the signs can be quite subtle at first. Speaking of signs and symptoms, let's talk about what to look out for. Kids with Cockayne syndrome often show delayed growth, sun-sensitive skin, and neurological problems like difficulty walking or hearing loss. And it's not just the brain, it can affect other organs too. So, how common is this syndrome? That's where things get really interesting. Cockayne syndrome is extremely rare, affecting about 2.7 per million newborns worldwide. The incidence rate is low, but it's crucial for parents to be aware of it. What about the gender ratio? Interestingly, Cockayne syndrome doesn't show a significant preference for males or females. It affects both genders almost equally. Now let's touch on survival rates. It's tough to talk about, but most children with Cockayne syndrome don't live beyond their teenage years. Early diagnosis and supportive care can make a big difference in quality of life, though. So, what's the takeaway here? Knowledge is power, especially when it comes to rare diseases like Cockayne syndrome. Being informed can help you spot early signs and seek medical advice sooner rather than later. That's it for today's deep dive. If you found this video helpful, don't forget to like, subscribe, and share. Until next time, stay curious and stay informed.